since I was in graduate school, my research interests were about child and adolescent health. And across my career, it's been about diet and physical activity, and substance abuse, alcohol, tobacco prevention. I've done work in violence prevention, done a little bit of work in mental health too. So what I like to say is I try to understand children and their families and their environments that either lead to healthier behaviors or detract from healthier behaviors. When I first started into public health, I thought that my job was going to be, talking to adults to help them, assist them in any way to adopt a healthier lifestyle, to prevent, early death from heart disease or cancer or some other type of diseases that are chronic in nature, diabetes too. But then what I slowly figured out was that the root causes of disease for many of these chronic diseases start younger and younger. So when I was in graduate school, we were doing interventions with usually men in their 40s to stop heart disease because they died younger than women at that time. And then I realized that maybe we need to start in our 30s to develop a longer trajectory when you eat healthier and become physically active. And then we thought, well, maybe in their 20s. And then it was kids in their teens. And now I'm working on preconception studies. It's hard to pick one thing that I'm most proud of, I guess, or I think that matters the most. And I think creating the Dell Center matters a lot, because now we have a whole system in place and it will continue on. And the regional campus too, so being part of that team. But then thirdly is the Catch Project, which has grown not just from myself, but Deanna, our director, and our dean, Cheryl Perry, and Andrew Springer, and Shrila Sharman. There's several people now involved in doing that, and I think that work will continue after say I retire someday. So I think it'll become a permanent, type of program, which should be always out there, trying to get better and trying to help, children, families, communities to be healthier. So advice to a public health student is, in my view, public health is social justice. So you can easily make, very personal connections to the work that you do and yourself, and bring it to your family level, to your community level, and larger.